The cervical detail.
After contacting the patient on the forehead with the knife edge of the hand, the doctor allows the patient's head to gently fall forward. Normal expected movement is for the spinous processes to flare or separate. The doctor extends the patient's head. Normal expected movement is for the spinous processes to approximate. Same positioning, the patient's head is rotated toward the doctor. Normal expected movement is opposite rotation of the spinous processes. Hands in the same position, the patient's head is laterally flexed toward the doctor. There is very little movement in this range of motion. The normal expected movement is for the spinous processes to move away from the side to which the head is bent. The doctor finds the posterior aspect of the mastoid and slides the fingers down to contact the T-piece of C1 and C2. The patient's head is flexed toward the side of the contact. The normal expected movement is for the T-piece to close together. The doctor rotates the patient's head toward them. The normal expected movement is for the C1 TP to rotate anterior past the C2 TP. The doctor contacts at the posterior inferior mastoid at the level of the C1 TP. The support hand is placed flat on the patient's head. Pushing through the contact hand, the patient's head will glide forward. Normal expected movement is for the occiput to travel anterior and inferior. The doctor contacts at the posterior inferior mastoid. The support hand is placed knife edge to the patient's forehead. Note that it does not push. Pushing through the contact hand, the patient's head will glide forward. Normal expected movement is for the occiput to travel anterior and inferior. Doctor's hands go on the side of the head, the patient's ears between the middle and ring finger. Slight lateral flexion is presented on the side being tested. Pushing anterior and inferior, the patient's head will glide forward. Normal expected movement is for the occiput to travel anterior and inferior.